The strengths perspective includes a set of theoretical principles developed starting in the late 1980s. In contrast to social work's previous preoccupation with problems and deficits, this perspective is balanced by the idea that all people have strengths. By identifying and building upon client strength, social workers can address problems by using clients' capacities and resources in the process of helping. In addition, the strengths perspective seeks to engage in a culturally responsive practice that remains flexible and creative when addressing social problems with diverse populations. This movement represents an important development within the field. An increasing number of social work educational programs have incorporated principles of the strengths perspective within their curriculum. Furthermore, many social service agencies have adopted strengths based principles within their work. This chapter will discuss the development of the strengths perspective as an important theoretical perspective guiding much of social work practice today. The terms and principles underlying this perspective are defined and described using examples from social work practice to illustrate each principle. These principles are used to guide a discussion regarding what social work practice looks like when adopting the strengths perspective, including a case example. Finally, the strengths and limitations of this perspective will also be discussed. So basically, when a social work is interacting with the client, they may come across many qualities of the client, and one of the notable feature of this theory is that the social worker will be able to use the strength of the client. There must be some strength of the client which can be harnessed during the engagement process, the initial stages of the client social worker interaction stages, and the social worker will have a way out to use the strength of the client in making the treatment and the intervention process and eventually the termination stage a successful one. So this chapter we will talk about today how to use the strength based perspective to yield the maximum potential of the client. Let's go back to some history now of the social work history. So, social work has a long history of intervening with individuals, families, and communities to enhance well being. Early efforts were seen in the late 1800s and early 1900s in activities such as home visiting provided by charitable organizations to provide for the needs of vulnerable and impoverished families. Others sought to address social problems through community development by providing advocacy and social services to help meet the needs of specific groups of people. During these early years, leaders who were engaged in these activities of helping sought to organize their work as a profession. By pulling this work together under a professionalized discipline known as social work, many people felt that educational programs could be developed to further advance the practice of helping. As part of this effort, in 1915, well-known educational specialist Abraham Flexner was invited to attend one of the first social work conferences to evaluate the degree to which social work activities represent a clearly defined profession. To the disappointment of many attendees, Flexner suggested that although the efforts associated with social work were important, the field had not progressed to a point that it could be considered a discipline or profession. Flexner compared social work with other fields such as the medical profession, identifying the ways in which this discipline engaged in clearly defined activities of practice. Social work, in contrast, was quite broad. In response, advocates who sought the professionalization of the field suggested social work adopt what is known as the medical model to guide future practice. You may be asking why a singular historical event that occurred almost 100 years ago is relevant to social work today. This early phase of social work informed the direction of the field for almost a century and continues to exert a strong influence on practice today. The medical model represents a theoretical framework that guides practice. Like the other theories and perspective covered in this book, the medical model rests on underlying principles that end up being translated into practice behaviors. For example, the medical model suggests the first step in problem resolution is to define or diagnose the problem. Labeling problems allows communication within and across discipline regarding what is happening. Definition of problems can lead to measurement of the problem, allowing a professional to treat or intervene to reduce symptoms associated with that problem. According to this model, social work practitioners are considered effective when they are able to reduce the incidence and severity of problems experienced. Some leaders felt adopting the medical model through the use of the problem solving process could advance social work practice. The problem solving process encompasses 6 steps. A. Define and assess the problem. B. Identify potential interventions or treatments that could reduce the problem. C. Evaluate the benefits and limitations of each potential intervention. D. Implement the chosen intervention. E. Evaluate the effectiveness of that intervention. And if successful, F. Terminate or close the social work relationship. The medical model offered a practical description of social work practice that was seen by many people as the answer the field was seeking. But there are some limitations of the medical model too. Although the adoption of the medical model may have represented an advance in the field a century ago, some people suggest there are limitations to a perspective from the perspective of social work, which focuses solely on labeling and treating social problems. First, you may have noticed how many times the word problem has been used in this chapter already. One critic of the medical model is its overemphasis on problems. There is no question that social workers are concerned with problems. However, being focused on problem identification, measurement, and intervention may cause a social worker to miss the strengths and successes also present within a person and situation. Second, the medical model places social work practitioners in the position of being experts. This position asserts social workers have specialized training and experience that allows them to perform professional activities within specified scopes of practice that others are not authorized to perform. Although education and experience are highly valued in social work, raising the expertise of the social worker to this degree can keep the expertise of the client from being acknowledged, hindering the process of shared decision making. So, in the medical profession, the interaction with the doctor and the patient is of a different is in a different way than compared to what a social worker and client usually have. Today when we see an actual social worker and client situation, and this is way after this discussion is being done here, which was 100 years ago, and today the social work practice what we see today is more of how in a more organized manner the social work profession is being done today, and it's mostly based on how the social worker and the client are constantly in touch with each other. And of course the strength and the assessment of what are the strengths of the client and what the client can do, what are the resources that are available to the client. They're always in touch with the client. Whereas in the medical profession, we know that the onus of how the treatment will look like is completely on the doctor, because they are the expert. They know how to diagnose and treat that particular problem, which is somatic. And here the problem is about, and in the social work profession, the problem is about not just the person but the environment, but the society, the social problems which comes with the client. So the interaction will look way different from what a doctor patient relation look like. And of course this discussion is about 100 years ago. We know how it looks today and how the relevance of social work profession is so clear today, that though the medical approach was taken as a starting point, and we came to know that there are some key takeaways of how to start or do a social work approach, but this was not something we can totally rely on. We needed to have the social work profession in a different way to be seen and to be approached, and that's where the limitations of the medical model come where. And finally, although labeling appears an efficient way to foster communication and research regarding social problems, social workers are increasingly concerned with stigma and how attaching diagnostic terminology to problems can change the way society views people and possibly even the way people view themselves, as discussed later in this book when focusing on social constructions in later chapters of 9 and 10. And so, moving towards the strengths perspective, this critique of the medical model does not deny that there are practical benefits to defining, measuring, and intervening to reduce problems. In addition, activities such as assessment and monitoring effectiveness are valued within social work. Finally, despite recognizing the limits of the medical model and regardless of the theory or perspective informing practice, social workers do and should care deeply about social problems such as family violence, poverty, child maltreatment, and addiction. These issues exert real and devastating effects on the children, adults, families, and communities with whom practitioners work. Thus, the strengths perspective seeks to balance a model focused solely on problems with one that acknowledges client strengths, past successes, and exceptions to the problems they face. The strengths perspective in social work was developed by leaders at University of Kansas in the late 1980s and throughout the 1990s, and its influence has spread across social work curricula. One of the first articles published about the strengths perspective by V. Krapp, Sullivan, and Gutsterd suggested that overemphasis on problem identification and labeling interferes with social workers' ability to highlight the worth and dignity of each individual. Although the article acknowledged there were previous discussions regarding strengths within the social work literature, it represents the first call to action to address the pervasive overemphasis on problem solving that was limiting social work practice. Soon after, Salibi edited the first edition of a book that incorporated the voices of multiple authors in describing the strengths perspective. Since that point, the strength perspective has been represented within both theoretical and research articles that describe the perspective and its implementation across multiple roles and settings. The strengths perspective offers important implication for direct practice, but is also important when considering program development, advocacy efforts, and policy.